went from the bonnet, found face down on the floor.
2, 3.
Pediatric trauma
It's
call.
a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
King's A&E. I'm tired now. Oh, are you jealous that in 26 minutes I finish it? No, I just don't know how I'm actually going to go to the gym this morning. It's age getting the better of you, babes.
I tend to think of myself like a fine wine. I'm definitely getting better as I get older, but with a few more wrinkles and grey hair.
Thanks very much. Bye. How many minutes? 10 minutes.
Adult stroke call, any resus, 10 minutes.
Jen is the sister in charge of resus today. She's been working at King's for over 10 years.
I'd like to say that I've grown up, but that naughty teenager is definitely there a lot. So hence why I've got quite a fast motorbike, and yeah, I've still got my games out in my shed.
Number 7, please.
My elderly patients, I just adore them. Their little stories, their amazing stubbornness to still be here no matter what life has thrown at them.
93? Looking good for 93.
We're long livers in our family.
Oh, yeah?
Yeah, my grandfather died at 107.
107? Good genes.
Yeah.
The older you get, the more you see the fact that in the end your life's going to come to an end. When you're young, you're carefree, and that seems such a massive long way away. The older you get, it seems to be coming closer and closer. Any resus? Yep.
Paramedics are bringing in a 74-year-old man after he fell down a flight of stairs and was knocked unconscious.
Okay, lovely. Thank you, bye.
Adult red phone, ETA 4 minutes. Adult red phone, ETA 4 minutes. Thank you.
Backwards down 10 carpeted steps. That's quite high.
Here, give us some of those, please. Any elderly patient is going to have bones that are somewhat a little bit more brittle. You know, they could have a fracture where you wouldn't have fractured. What you consider maybe a minor injury from falling down the stairs could then be a drastic injury where they could lose the use of their arms or their legs.
Loud and clear.
All right, so Brian is a 74-year-old gentleman. This evening he's been climbing up the stairs but has fallen backwards down 10 carpeted stairs. His partner witnessed it. She said he was unconscious for approximately 4 to 5 minutes. Brian's Brian suffers with dementia, so his partner says his level now is normal for him, which makes assessing him quite difficult. He's not able to be specific about any pain, he just says he hurts all over.
Brian, I'm Anna, one of the doctors, all right? I know it's all a bit scary. You're in hospital. You've just had a bit of a tumble, all right? So we're just having a little look at you, and we're going to take some blood tests. A little scratch. All done. That's it. All done. Yeah. Sorry. How do I say that?
Brian lives in sheltered accommodation and was staying at his partner Margaret's house at the time of the accident. She travelled with him in the ambulance to King's.
I normally help him to the bottom of the stairs, and then he'd go up himself. And he called down and he said, "Oh, I'm losing my balance." And before I could get to him, he tumbled backward and he went into a little table that was there in a flower pot and just smashed it against the wall. And he was unconscious at that point. He didn't respond when I said, "Brian," you know, and he has had falls before, but nothing as bad as that.
Help!
Okay, don't worry, we'll get your wife in with you in a second, okay?
Help me, please. Somebody.
Tell me how you met him.
Well, a fairly familiar story in a wine bar in 1977. It was one of these things, I think, when you both rush into the bar and just started chatting. This sounds a very strange thing to say, but he was very well spoken and I liked that. Had good manners.
Right, sweetheart.
Sorry.
Nice and still. We're gonna do everything for you, okay?
Okay.
Staff are concerned Brian may have sustained damage to his head and neck, and with his confused state, they must examine his spine to locate any possible broken vertebrae.
That's it. Keep your head down, Brian. Down, Brian. Down, Brian.
It's okay, Brian.
1, 2, 3, roll.
Oh,
relax, Brian.
Hi, Brian. Let me know if it's sore where I'm pressing.
Oh. You've got this person who's suffering with dementia, who's completely scared and has got absolutely no idea what's going on, and that's hard.
Is that painful, Brian, in your back? Okay. I think that we should do his thoracic spine.
Because you can't put them in like a little safety net and make sure that everything's going to be all right. And it's really, really difficult because they're out of their comfort zone. They don't understand what's going on. You know, they get quite frightened.
Okay, 1, 2, 3, back.
Relax, Brian.
Just
Rubbish. All right, Brian, it's all right, mate.
Get his pockets, Brian.
Are you all right, mate? Ripped loads of skin off my finger with a drill by accident. I'm in A&E, innit? What am I gonna do with one fucking hand, mate? I know, but what am I gonna do with one hand?
No, the block.
Could have this as well.
Oh, God, what's going on?
Brian, you're in the hospital, my darling. All right?
I don't understand the word you're saying.
You're in the hospital. Okay?
Yes.
Okay. And you've had a fall, I think?
Have I?
Yeah.
74-year-old Brian has dementia and has fallen backwards down a flight of steps. Doctors are still trying to assess the severity of his injuries.
You all right? Who are you in here with?
Brian.
Oh, Brian. Come and see Brian. Come and say hello to him. She doesn't like this very much.
No, I know he's... Hi, dear, it's me. Hi, it's Max.
You come up and have a chat.
Hey, it's me. What you doing down there?
I don't know.
Falling down the stairs. Yeah. Demolish the plant pot.
I'm sorry.
No, don't worry about the plant pot. You're more important than the plant pot. I think Brian would be the first to say he never thought of himself as handsome, but he had a sort of personality that kind of, I think, engaged people. God, it looks most uncomfortable. Well, it's just in case you damaged your neck when you fell. He was very outgoing, very gregarious. He was bright, intelligent. How you feeling?
Edgy.
Edgy, yeah, I'm not surprised, dear. Yeah. When he was younger, he worked in banking. He used to kind of get up and go off to work, you know, quite happily. I think he really missed work when, you know, his job ended. He was made redundant when he was about 58. And I think he was really depressed by it. Yeah, put your hand under, keep yourself nice and warm. I think he found me reliable and dependable. And I've always kind of looked after him.
Simon.
Hi, mate.
Hello. Good morning.
Good morning.
Okay. Off to you.
Thank you.
My name is Dr. Kuzmin. I'm one of the doctors here. Have a seat. Make yourself comfortable. Okay. So, what happened to you?
I was at work and I was using a cordless drill. Basically, drill, cordless drill, yeah. And it had like a metal bit in it, and my glove got caught around the metal bit, and then it took my hand with it, and basically just ripped my index finger.
Okay. Ripped the glove, piece of glove, together with the skin around it.
Yeah, and kind of, yeah. It's really painful. Really painful, yeah.
Okay, can I look at it? Oops, oh, sorry. Okay, sorry. Okay. You all right?
Yeah.
Do you want a bit of time?
No, crack on.
Okay. Tell you what, let's X-ray it first. X-ray your finger, because if there is a huge flap of skin, you know, I don't want to miss any fracture. Okay?
Yeah, good idea.
Okay. You all right?
Yep.
Boy, oh, you tapped it. Wait, boy.
Hello, young man. I'm just going to have a listen to you. You take some deep breaths for me.
Don't go. Boy, don't touch it. Oh.
Huge brain. biggest one I've seen today. You're going to be very clever when you grow up.
The King's Emergency Pediatric Department sees between 80 and 100 children a day. Ruth is the junior doctor on shift.
Treating children brings out the inner child in me a bit. It makes me feel a bit more like one of the kids. I don't think I've ever grown up properly. You know, the minute there's small children around, I'm running around too, being like, blast off for Mars and all this.
You know, giraffes are my favouriteest animal.
Oh, they're lovely.
And you know, they sleep standing up.
So they stand up and then they have a little sleep and then they wake up again. So they have loads of tiny naps through the day and no big sleep. It's like Daddy.
I have two older sisters, so I was always sort of running after them and trying to sort of catch up with them and do what they're doing. And I was a bit accident-prone. So my mum spent her fair share of time patching us up and sitting waiting for our heads to be stitched and all the rest of it.
Sylvester has brought in his 2-year-old son, Sylvester Jr.
Come here, boy.
Oh, sorry.
Wow, fast out of the game.
Oh. Yeah, well done.
Now, say Junior is more outgoing.
No, but you need to share.
And those times he wants to play, he wants to play.
But everything is not yours, okay? You need to share, huh?
Sometimes he does some mischievous things. But children at his age will sometimes try to test the boundaries.
Sylvester!
Hello. Hello.
Hi.
Yeah.
Come with me. My name's Ruth. I'm one of the doctors here.
Hello, Ruth.
Hello, Sylvester. Oh.
Boy.
Going for the bubbles. You've got your priority seat. That's great. Should we pop you on the bed? That's it. So what happened?
Right, we're at church and all the kids were playing.
Yeah.
And then he fell and hit his head on the chair.
So I'm just going to have a check out of him, just looking at all his nerves to make sure, because it is a head injury, that he's not done any damage to himself.
Yeah.
And then we'll have a look at the wound. Won't we?
Okay.
So, you're going to squeeze my fingers? Squeeze like that?
Boy, squeeze. No, boy, that's it. Squeeze.
No, does not want to play. Oh.
Boy, relax.
Push.
Boy, push.
Oh, good
That's
stuff. You're so twitchy and wriggly. I can see how this injury happened.
Yeah.
Hello.
Being very strict on children to some extent does not really do them very good. Because if he's somebody who is outgoing, I think we need to give him the support to do that. Because otherwise we might sort of impede him being of himself. I would say I'm very, very happy to have a child as Junior. I really love everything about him.
Give me 5 then, boy. Give me 5, boy. Give me 5. Give Daddy 5. Give me 5. Hey, give me 5. No. Boy, don't.
Grace,
Yeah,
are you there?
I'm here. Yeah, I'm right by you.
Brian is still in resus after having a serious fall down a staircase. As he was knocked unconscious, staff are concerned he may have caused damage to his brain.
Hello.
Hello.
Are you Brian's partner?
Yeah.
Hello,
yeah,
I'm Lucia. I'm one of
yeah.
the doctors. So, I've heard that he's had a bit of a tumble. He came down
He
a
did,
set of
he
stairs.
fell backwards.
Fell
and-
backwards,
yeah,
and
yeah.
you said that he passed out for a few minutes.
Yeah.
Okay.
Yeah.
So what we're gonna do is we want to make sure that his head is okay.
Yeah.
So we're gonna take him to the CT scanner and do a scan of his head.
Okay.
And we're gonna have a look at his neck as well. And he lives with you.
Well, no, he's with me weekends and he lives alone the rest of the week and he has social services.
And who comes in and helps?
He's got a carer 3 times a day. I mean, his dementia is quite advanced, yeah. It's very difficult because I suppose when you're getting older, you think, oh, well, you know, you forget things or you get a bit muddled up and forget names and that. So I can't really identify a moment when I thought there's something wrong here.
Nice.
Uh-huh. You don't want to what?
So what if you be left alone?
No, I'm not going to leave you alone. I'm here with you. You miss the person that was there. You know, the person that you knew and cared about. Well, you still care about it, but that... sometimes I think it would be really nice just to have the old Brian back for a few days, even though you know that's not going to happen. So... Right. I'm coming with you.
Does he know who you are?
Oh, yeah. It's nice to know that there's still that, well, one, that he still has that level of recognition and he still can interact with me. He finds it very difficult now to articulate. But the one thing he just keeps saying is that he loves me. I think when that goes, I think that'll be awful. I mean, that will really seem like the end.
Did you have it?
Yeah.
Done. Just come back to 6. I'll have a look at the X-rays. How is the pain at the moment?
It's getting...
It's getting better?
Yeah, it's getting better.
Good. There is no fracture. Good news. Let's try to get this dressing off. Okay.
It's not that bad, is it?
No, it's not too bad. You all right?
Yeah.
Yeah? Can I touch it?
I'd rather you didn't. Do you need to?
Okay. Okay.
Do you need to...
I just need to examine it.
Okay.
Okay. I'm not doing anything. I'm just going to touch that this way. Okay? All right.
Okay.
Okay. Give me a second. quite distressed.
I think it's more of the fault of it hurting, but I don't think it hurts that much, do you know what I mean?
Yeah, I have the same feeling, but...
I think you're gonna hurt me more than it actually hurts, do you know what I mean? It's like something out of a cartoon.
Yeah.
You know, when someone hurts their finger.
Obviously, if the pain gets worse, either go and see your GP or come back to us. Okay?
Okay. Yeah, brilliant. Thank you.
Okay.
Thanks very much.
All right, take care of yourself. Okay.
All right, so I just want to give his forehead a wash.
Right.
I think it can be closed with glue and stereo strips. It doesn't look too deep.
Okay.
I think the best way to do this is if you sit and have him on your lap, and you can try to hold him still.
Okay, yeah. Boy, let's do this first, okay? Come on.
Let me just get my kit out. I'm going to put a special cape on you. Hang on, we'll turn it around a little. There we go.
I mean, the reason why I wanted Kate is just to ensure that there is legacy after we've gone. Having a child is a privilege, you know. We don't see it as an obstacle or a hindrance or a burden. Then I want to catch that moment with the children because they grow very fast. And it's something when it passes, you can't get it back.
There we go.
Good boy.
Brilliant.
Brilliant, boy.
Oh, well done. Quick bit of glue, then some magic stickers, and then we'll be done.
You know, it's amazing how quickly it can break down, actually, with children. You know, it's a foreign environment to them, and, you know, unlike adults, they don't have this thought process of, oh, well, it's got to be done. So, you know, it can just go like that.
You got him, Dad?
Yeah.
All right, Sausage. Oh, just very
good
quickly.
boy, good boy.
Boy, nearly
All right,
done.
nearly done.
Boy, nearly done.
All done, all done.
Well done.
Oh.
Good. You did it again, boy. One more. This one.
You don't like it? You don't like it? Here we go.
Okay, thank you very much.
Well done, young man.
The youth of today can be good generation for the future if adults of today give them the right support, in not just bringing them to the world, but also to continue from where we have left. Whatever we have done, the children will do better than us.
Thank you very much. Thank you, Doctor. Thank you.
The thing with children is it's something to carry on, actually. I think it's remembering the past and taking things forward, and if you don't have children, I think you don't get quite that. I mean, I think you just stop. You're going to be forgotten eventually anyway, but it keeps you in the world a little bit longer.
A patient is being brought to A&E after suffering a suspected stroke.
Sorry, say that again? Droopiness on the side of his face. Oh, right, great, thanks. Great.
Adult stroke or any resus?
Leonard, a builder from South London, was at home when he suddenly lost sensation down his left side. He's come in with his long-term partner, Suzanne.
You had this left facial droop.
It's like I saw pins and needles. You know.
Was it coming in from the sides?
Yeah.
Or was it all over?
It was like
Yeah.
Both eyes?
Yeah.
And did you have any pain?
No, no pain at all. No pain, no headaches, no nothing.
I was 18 when I met Len. I was going to get a cab and he was one of the cab drivers. I was working as a croupier in the casino in Mayfair. So he used to pick me up after my shift and that was it. I just thought he was absolutely gorgeous.
What was she wearing?
Short skirt. When we got together, I kept saying, pull it down, it's too short, pull it down, pull it down.
She got like a bit of leg.
Yeah, she had lovely legs.
You still got any tingling in your face?
Not a great deal, a little bit, not.
Len and I have 6 children. Laura's 31, Nathan is 20, then Gabrielle is 16, Zara is 14, James is 13, and Anastasia is 7.
We didn't say, right, we're going to have a child tomorrow. I think we have our children in a loving thing. We go to bed and we make love and a child comes. And that's how I think all 6 of them has happened.
And he's running around carrying them on his back. He walks with them on his shoes. They stand on his feet and he's walking along with them.
Okay.
And I'm 50 anyway, so it's not like I'm a spring chicken anymore. But I think it does keep us young, keeps us very young.
Leonard is 70 years old. With the loss of sensation down his left side, the King's stroke team need to keep him under close observation.
All right. Don't worry.
Not going to worry.
Brian is waiting for the results of his CT scan to confirm whether or not he has a brain injury or damage to his neck.
You definitely have to have a shave tomorrow. You're very hairy.
What makes you stick around?
Because I care about him, you know. I wouldn't... I think I feel very protective towards Brian. Yeah, I'm fine, dear. Give me a hand. Occasionally he will say things and I'll say, oh, you didn't mean that, did you? And I'll say, you meant that. And then we have a laugh. We still have a little laugh together. I mean, those moments are quite nice.
Hello, my dear. I've had a look at your scans. The brain seems good. As good as it can be. No bleeding in the brain. Everything's okay. I'm going to see if I can take these off. Okay? Have you got pain anywhere else?
No,
Pain in your back at all?
I don't think so.
Okay, let's have a look.
He's actually done very well lying there. I thought he'd, not cope as well, yeah.
Take these off. Now I want you to move your neck to this side. Slightly.
Oh God, he's covered in soil. Would you like it? Would you like your glasses on now? Yeah, put them on. That's it.
Hi, looks a bit more sprightly now.
Looks a bit better, doesn't it?
Yeah, very nice. Oh,
Yeah.
specs on and everything.
Yeah.
Brilliant.
For quite a while in recent years, I've felt very sad about it. That he and other people in similar position can end up like that. And I think I've come through that now. Oh, stay where you are, Brian. They're going to come and sort you out, okay?
Right.
Bloody plant pots all over you. Honestly, I don't know.
Brian will be admitted to a ward for further observation to rule out any injury to his brain.
Right, I'm going to leave you now. I'm going to leave you and I'm going to go home and get a few hours kip.
All right.
And they'll look after you here for a little while. And I'll come and get you tomorrow. Okay? Right. And give me a kiss. Bye-bye. I said to him a long time ago, you know, I'll always be there for you. And here I am.
When I was single, I worked, you know, in a nightclub. That's what I did. I was the nightclub medic, and, you know, that was it.
Should do that on the weekend.
Yeah. I mean, that was that best 8 years. I think I do everything that I used to do. I may be not so off the cuff as I used to be. I mean, I spent many years going out and, you know, not getting in for whole weekends, so that's definitely something that I've grown up. And also, my family time's really important. It was a laugh. Very naughty times. But I met, you know, met my partner there as well.
There you go.
Yeah, I've decided I'm not going to go clubbing anymore. It's too busy, too noisy, and I'm too old, so people have to come clubbing around my house. That's it.
"70-year-old builder Leonard was brought into resus after having a suspected stroke at home.
I'm just going to go and let the doctor know about what you were telling me earlier.
Yeah, thank you.
No, we have to check. But you were supposed to be taking the aspirin. How long have you not been taking that for that you're supposed to be?
Not going to lie to you, I've been taking it for about a month.
And when did you get put on it?
Well, from the first time. I think...
Was that in 2008?
It was before 2008, wasn't it? Because your first mini stroke you had was about 98-ish. So I think you were prescribed aspirin then, weren't you?
As Leonard has suffered previous strokes, he's at high risk of having more serious episodes. Doctors want a CT scan of his head to identify any blood clots in the brain.
Thank you.
Len and I, when we first met, there wasn't a huge amount of mixed couples about. I remember walking down the street and people shouting out of their cars. And I found it difficult to understand because I didn't see anything in colour. I just knew that I loved Len and there wasn't a colour issue between us. I think it probably made us stronger together. I think we looked at each other and we knew that there was nothing going to come between us.
Are you a romantic couple?
I don't know what to say. I'm embarrassed.
With 6 children, I should think so. I'd be there and she'd come and hug me and say, I really love you, I really, really love you. And I say the same to her. We keep telling each other all the time.
I can't imagine life without Len. He's my rock. He definitely is my rock.
Leonard is waiting for his scan results to see if there are any harmful blood clots in his brain.
You know here, you've been getting like puffiness there. What's that?
I don't know, I think that's just age, love, you know.
I don't know. Just saying.
Alex Ferguson has it. We're about the same age, and he gets very puffy there.
I'll have to go and speak to Alex then.
Yeah, have a little word with him.
He's always been very fit and well. We have to tell him not to work so hard and not to overdo things, but he's just a worker. He's a born worker. He's out there at the age he is now. He still wants to work every single day.
I mean, you tell people my age and they sort of said, no, you're not that old. And sometimes I wonder, did they get my age, my birth certificate wrong?
No, you're just young for your age.
I think it's Jamaican in me. I think they say you're as young as you feel, but I don't feel old in the sense that, you know, I'm going down the road with a walking stick and that. It's only the man above who knows. And as I said, if he's going to do the business for you, then he'll do it, you know.
So the way they reported it, they think that there isn't a clot. There is a little bit of a narrowing of a blood vessel in the brain, and it's not possible to say at this stage whether this is what giving you the symptoms or not. We're going to keep an eye on you. I just spoke to my consultant. She would like you to be admitted. We'll give you some aspirin now to thin your blood a little bit. We will be keeping an eye on you in case the symptoms return. And I think it's safer for you to be in the hospital at the moment rather than going home.
Yeah.
Okay? Good.
No, thank you very much.
Thank you. I think that's good.
With no sign of any blood clots, Leonard will be admitted to King's Specialist Stroke Unit for further treatment.
Age catches up in everyone. You get up in the morning and you're back, oh, my back. But I think sometimes it's the bed. Yeah. Is it possible I could do a wee?
Yeah. Are you going to be okay on your feet?
Yeah.
Shall I get your sandals?
I don't let it worry me. I just take life as it comes, you know.
Lovely, that's good. Up and walking around.
Yeah.
That's what we need.
I go to bed at night and I say my prayers every night religiously. And I ask God to keep me for sort of another 10 years. If I get a bit longer, I'll be happy.
You're doing really well. You are, dear. Quite a hero, yeah.
I am taking my aspirin every day, religiously. So touch wood. Nothing has happened since then.
He feels a lot younger than he is, and that's the important thing, as long as he feels that way. I'm not going to let him get old anyway.
Good night. Good night.
Thank you, thank you, thank you.
It's a pleasure, always.
Would you say you're currently in your prime?
No, I don't think I've got there yet. I think my prime is yet to come. I don't want to be, you know, thinking, oh God, you know, my knees hurt, I can't get up. No, I'll be up, I'll be out there, and hopefully I'll be walking up hills or, you know, well, hopefully still riding my motorbike, but that might be a bit hard pushed. There's a little bit of me that's a bit scared about getting older, but I think as long as I keep going, I'm not going to stop.